inflammation of the stomach lining. And to help us discuss further, I'm joined by Mr. Blessing Spiri, who works as a clinical officer at Bowling Clinic. How are you, and welcome to the program.
Thank you so much for having me, and I'm fine, thank you. How are you?
I'm fine, thank you. So let's get started. What is gastritis, and how does it affect the stomach?
All right, thank you so much. I think that's an important question, and it's very important to understand what really gastritis is and how it actually presents itself. So gastritis is an inflammation of the stomach lining. So the inflammation comes as a result due to certain factors. It can be infection or behavioral causes. It's caused by an infection that is called H. pylori. So this H. pylori bacteria actually causes this inflammation in the stomach lining. So then there are other causes or other risk factors that can actually present due to the fact that to cause this gastritis. So we have excessive alcohol drinking, smoking, poor eating habits, and we also have things like eating too much spices. This can actually cause a reaction or an infection that can cause gastritis.
Okay, and I wanted to explain a little bit more in detail. Having mentioned some of the common causes, how do these now affect the stomach?
All right, so how do these affect the stomach? So now, due to let's say that when we look at the eating of spices, so now eating of spices can actually increase the production of gastric fluid. So now this gastric fluid can actually now start raising from the stomach lining and going upwards the alimentary canal, and then it causes the inflammation. So now, because of an infection now starting to cause this infection causing a disease, so now it starts to cause the lining of the stomach to actually inflame, so causing now a problem in gastritis. So now let's look at maybe smoking. So now, how does smoking really affect the aspect of one being having gastritis? So now we look at the smoking. The smoking now changes the environment of the alimentary canal. So now, as this person smokes, yes, it may go to the respiratory part, but also can also cause effects on the alimentary canal. So now it changes the atmosphere or the environment of the stomach lining, causing the H. pylori, the bacteria H. pylori, to actually now become more infectious in the stomach. So now, as this disease continues to proceed, it now has this inflammation and this swelling happening in the stomach lining, even inclusive of the esophagus as well.
Okay, and how can you describe the symptoms that people should really watch out for?
All right. So now the symptoms. So as it, like I earlier mentioned, said that there is sometimes an upclimb of the gastric fluid. So usually individuals may have, or clients may have, or patients may have epigastric pain. So pain that is maybe located on the epigastric region, just in between the chest. And this pain is more like a heartburn kind of the presentation. Like people will say, oh no, I've come with a heartburn, I feel like my heart is burning, but it is a presentation of gastritis. So it may also come with abdominal fullness, and also in some cases you find the person will also come with a loose stool, not a diarrhea type of stool, but loose stool, which is more it's more syrupy or less, more like an actual diarrhea infection. Then you also find that an individual may come with abdominal pain as well. So this abdominal pain may be the whole entire abdomen or just certain parts of the abdomen. But more prominently, we would find that there would be there'll be gastric pain. Somebody also complaining of excessive burping, and that be more likely the cause of that will bring a client to the facility.
Okay, and when is the best time to seek medical attention? I know nowadays in our society, we get to see people, possibly somebody just gets a serious attack, and the moment they go to the hospital, they're told, no, this is gastritis and all that. How easy and when is it the best time that somebody out there can go and just seek medical checkups for such?
All right, so the best time to actually go and seek for help is when you actually have the first symptoms, and not just having the symptoms, also learn about how you can actually prevent these symptoms from happening or prevent these cases from happening. So gastritis is something that can happen because of poor habits that one can develop. So now these habits can cause a reoccurrence of this gastritis. So the most important thing is to ensure that we minimize the attacks as much as possible. So when one has maybe, if your first presentation maybe is abdominal fullness, come to the facility, let's see you and let's find out what is really causing this abdominal fullness. It could be gastritis, and we manage that gastritis, and then you'll be better. Then we'll also encourage this individual to actually continuously maintain a certain standard of life that will help this individual not to have reoccurrence of this infection, reoccurrence of these attacks.
And what is the possible successful treatment for gastritis? Because again, you find that people sometimes will just take whatever they feel like at home, or what the neighbor has told them, and no, possibly if you take this, this will help you, even before they seek that medical help. But what is the most successful medical treatment?
So the successful medical treatment that we have is what we call a triple therapy, which will involve 2 antibiotics and a proton pump inhibitor. So this proton pump inhibitor would prescribe omeprazole, and then also add magnesium, which will help create a layer in the stomach just to minimize the gases, the gastric fluid from uprising and or causing more problems. So we will treat the infection by giving 2 antibiotics that will be prescribed by a clinician. These 2 antibiotics may differ from clinician to clinician or response to body. Let's say if an individual is resistant to amoxil, we'll not give the amoxil. We'll have to find a different alternative of medication that we will give. Then we'll also give painkillers to this individual so that we can actually also manage the pain. Because this individual may come in pain, and if we do not manage the pain, when you just give the antibiotics and the proton pump inhibitor, it will not help this individual to actually recover. But we also have to give painkillers so that this person can actually preserve themselves or manage that pain. Then again, on painkillers, we have very specific on what type of painkillers we're actually giving. So we do not give certain painkillers like brufen or aspirin. This is because these can actually cause the gastritis as well. So there are certain painkillers that can exacerbate the condition or put at higher risk of having the condition. So that it's very important that one actually comes to the facility and get prescribed the right medication to manage the gastritis. And also health education is very, very important, because it's not only medication, not only the infection that can cause this problem. We also have issues of eating too much spices, which may actually cause a person being prone to having gastritis. If you have individuals that abuse painkillers like aspirin or painkillers like brufen, they are more prone to have this infection.
Okay, thank you. And to our viewers and listeners, just in case you just tuned in, this is Health Bit, a program that focuses on our health and well-being. And today we are discussing gastritis. And with me, I have Mr. Perry. Moving on, are there any specific foods that somebody has to avoid in case they have gastritis that can put them in danger?
All right. I think that's an important question and an important thing to actually talk about. So there are a number of foods that are listed, but it's also not. It differs from person to person, may I say. There's certain instances where we find that an individual takes the sardines, or in our local language, kapenta, and they have gastritis, or maybe take vegetables with a mixture of groundnuts, pounded groundnuts, and then they have this infection called gastritis. Then we also have certain foods that can, other foods that can actually prompt this. We have beans. For some individuals that can actually react to beans, but there are some would also take beans, but do not have the gastritis. There's also cabbage, eating of cabbage. Some have reactions to that, some don't. So there's no restriction per se to say this type of food should be avoided, but it may require one to know which foods trigger this gastritis. Then we also have carbonated drinks. So carbonated drinks are mostly the primary cause of this gastritis that we see in the facilities, and also alcohol as well.
Okay, I know you've mentioned the carbonated drinks, and these drinks are mostly taken by adults, but then we see this case of gastritis even increasing also in children. What could be the leading cause to this?
All right, so the leading cause to this, one of the things that we see is that children usually like eating snacks. So these snacks that we have are they have high spice levels in them. So if we give examples of knickknacks, these knickknacks have got so much spices. So these spices can actually cause the gastritis, can actually trigger the gastritis. Not only triggering the gastritis, so in certain children, we find that these children can actually develop a habit of only eating snacks and preferring snacks over proper meals, preferring snacks over proper fruits. So hence this child might even go into malnutrition because of eating these snacks. So snacks have also caused have raised the number of cases of gastritis. So it's very important. Snacks may be good once in a while, but the most permanent thing is to have a balanced and a healthy snack that is prepared from home. It may be fruits cut up in a very good way just to interest the child to eat.
Okay, and what lifestyle changes can prevent gastritis?
Gastritis. All right, thank you so much. So some of the lifestyle changes that we can actually adopt as the community, as individuals, is one, eating warm food is one of the things that we really need to actually develop. Reducing intake of these foods that may trigger gastritis. So if you had a case by eating beans, the intake, not all the time, but it might be sometimes. When consistent use of certain foods can cause gastritis to actually appear. The other things we can also do is switch our intake of carbonated drinks to pure juices that can be taken. Let's say maybe a fruit juice, or you can make a fruit punch. Those are good for. They will not cause you to have gastritis. They will not cause you to have any of these attacks. Then also limiting our intake of lemons. Sometimes lemons, I know, can also cause or put someone into a gastritic attack because they are overusing them. But I love lemon tea. But you have to reduce. Minimal intake is okay. Excessive intake is really something that will cause more pain or more attacks than usual. And also avoiding alcohol or reducing the amount of intake of alcohol can also reduce the chances of one getting into a gastritic attack.
Okay, and let's talk about, is there a need for a necessary follow-up checkup after somebody has gone through a gastritis checkup?
Yes, it's very, very important. one of the things is that you're trying to ensure that this individual is actually healthy and still maintaining the right amount of care. So we can only check out the progress of an individual if we are reviewing them and seeing whether they've had the attack or not. Have they discovered which foods are to be avoided? What changes have they done in their lifestyle that they can try to adopt and continue adopting? So as health personnel, I think it's very, very important for us to actually call them back and ask them to do a review, because it's important that you note what changes they have done and see how you can implement those, because you're just trying to ensure that they implement, because one's health is in one's own hands. So I as a health personnel can only encourage my patient to actually continue accessing good health in whatever they have been practicing, and just ensuring that they have done so much to help themselves.
Okay, very insightful. And before we just wrap up, what would be your key message to our viewers and listeners out there on how they can take good care of their stomach and just avoid having gastritis?
All right, thank you so much. My message there to the viewers would be, or to the communities in Zambia, is that we should be able to take advantage of our health by ensuring that we eat the right food, or pack the right food for our children, so that we reduce the chances of gastritis, so we reduce the chances of infections that involve the stomach, or the infections that involve the stomach. So if we are able to manage how we eat, manage how we take in drinks, we will be able to manage our health properly, and we will reduce the chances of us having infections. Gastritis is not just a simple infection. It is an infection that can actually come in as an emergency and cause serious pain to an individual who comes through. Sometimes it's very difficult to actually pinpoint it in children, because when they might come with an abdominal pain, not sure of what is causing the abdominal pain. So if we are able to adopt certain cultures, adopt certain health behavior that will help us to actually improve our health, then that will reduce the chances of us having gastritis. As much as possible, eat warm food, and also protect yourself from drinking carbonated drinks, and have proper drinks that can reduce the chances of you having gastritis.
Okay, so thank you very much, Mr. Piri. Quite insightful information that you've given, and I hope our viewers and listeners have learned one or two things, because I know gastritis in our community, in our society today, is very much common. And so indeed, from what I've learned personally, it's something that is manageable, and with the right care and lifestyle, it's something that can be managed.
Yes.
And just to close up, your final words.
So my final words, we as a community can take advantage of our health care facilities. So let's ensure that when we have infections like gastritis, let's come to the facility. Let's not listen to advice from the community. We have facilities that are nearby us, so that we can access good healthcare service and ensure that we do not have these attacks. Management of a healthcare condition is not just about taking medication. There's extra information that you can actually get from your healthcare facility, so that you can ensure that you are well managed and well cared for, and you will not have the experience of that condition again.
Thank you. Well, thank you very much once again. And to our viewers out there, I hope you've learned a lot. Remember to visit a health facility whenever you have problems with your stomach. Don't take into personal self-prescriptions. And so from me, Taza Piri, remember to keep a healthy lifestyle.